Hi, my name is Dr. Ansha and let's talk today about postpartum adjustment struggles. A lot of times, psychological distress actually increases in the postpartum period because the family is holding up to a lot of myths that makes the adjustment process very difficult for the new mother, the new baby and the new father. Let's dissolve these myths. And it is important that we know that these beliefs are actually mythical. And what are these? The first one is related to self-care and bathing. So a lot of times it is a myth to believe that the mother should not take bath until 2 weeks after birth or until a week after birth. This is not advisable as it is going to increase her risk of multiple infections. So discuss with your doctor in what ways bathing can be provided. The second one is related to diet. So a lot of times it is said that certain food groups should be increased and certain food groups should be completely avoided and the diet should be restricted for the new mother to help the newly born baby digest the mother's milk. But that is also a form of myth. The mother should follow a balanced diet, eat whatever is easily digestible to her. In case of having medical conditions, the doctor may give her a special diet which will be balanced and nutritive. And please understand, the requirement of the new mother post-pregnancy diet-wise is exactly the same as during pregnancy. Because a lot of energy and nutrition is also required for feeding and healthy growth of the baby outside the mother's body while the child is still dependent on the mother's milk. The third is related to exercise. So it is said that the mother should be on the bed, rest, sleep, be immobile until 2 months after birth of the new baby. And this is also something which is not entirely true. Some form of mobility, light exercises can be increased in the room where the mother is housing or inside the house as well to help her become a little slowly physically active. In fact, you can also consult your physiotherapist because the strengthening of muscles during the postpartum period is also something which is advisable. It will make her strong physically, mentally and help her adjust her body according to the new routines of childcare. The next is related to the room where the mother is staying. So a lot of times it is advised that the room should be dark. It should not have windows. It should be secluded from the other rooms of the house. People should not visit the room at all. The mother should not come outside the room where childcare is happening. This is very restrictive because self-isolating the mother is going to increase her risk of falling into mood disorders, anxiety disorders and also obsessive compulsive anxiety during those 2 months of post-delivery. So the room should be aerated, it should have windows, it is advisable to have a small balcony, there should be adequate sunlight, 1 or 2 people can be regularly allowed to visit the room, it should be clean, it should be hygienically maintained, the floors, the bed sheets, the entire area where the mother and the baby are staying. The next is related to the newly formed role. So a lot of times it is said that since the mother is in pain or since the mother doesn't know how to handle the baby, since the mother is not good at feeding the baby, she should be allowed to rest. So the baby is taken away into somebody else's arms and physically distant with the new mother. This is not advisable. The baby and the mother house in the same room and are on the same bed because this helps them be better at connection, feeding, bonding, attachment behaviors and soothing as well. These things will slowly develop as the mother acquires her new role and she can be assisted at it. But distancing her from the baby just because she is in pain, just because it is a very tiresome duty, just because she is not able to do it in the initial days is not advisable. So these are some of the myths which really stress out the new mothers. It may also stress out the newly formed family and the new fathers. The last strategy which can help actually resolve all these myths is the involvement of the newly formed father in childcare. In modern societies, the fathers should be enrolled in all definite forms of childcare. So whatever is biologically possible for the father, he should do for the newly formed child and for the newly formed family, which is taking turns at the hygiene, bathing, childcare routines of the mother, re-establishment of symmetry and the housing responsibilities. All of these are something which both the newly formed parents can share, and the family should help them at it. I hope this video helps you out and helps your family as well, and we get more and more healthy mothers, families, fathers and babies. Thank you.